So welcome and good afternoon. My name is Adam Rust, and I'm a senior policy advisor at NCRC. And I'm here to welcome you today to a panel that I think you'll find to be very fascinating, addressing food insecurity for those suffering most from income inequality. Today, you will hear from CEOs of 3 regional food banks. In the last year, their institutions have been asked to respond to historically significant levels of need. In fact, the Feeding America Network, which is a coalition of food banks across the country, has now reported that in 2020, their members served 6.1 billion meals, an increase of 44% from the prior year. In 2020, 45 million Americans, including 15 million children, were designated as being food insecure, meaning that in the last period of time, those individuals lived in households that were not able to afford to provide enough food for a healthy and active lifestyle for their members. Now, an important piece of context to that statistic that I think many of you are familiar with is that hunger itself doesn't exist in a silo. Hunger is a part of an overlapping series of issues, right? So when we see people who are hungry, it's rarely that's only the case. It's other things as well: a lack of affordable housing, educational inequities, chronic health problems, high medical costs, and then most fundamentally, low wages. And the fact that so many members of our coalition are at the point of change underscores why this issue is so important to NCRC. And we've heard from you, including in our recent community benefits agreements conversations with banks, that you are very concerned about addressing hunger in your communities. So you know that as an organization, NCRC's fundamental goal is to work to achieve a just economy. And yet the presence of such widespread hunger is itself a foundational challenge to the idea that we do live in such a society. Having enough to eat is a precondition for all kinds of basic fundamental securities. So I want you to know, I want to emphasize this point, that our founder, John Taylor, is applying his passion to this work. He cares about it deeply, and it's something that he feels strongly that it will be a part of NCRC's work for years to come in the future. Relatedly, you should know that addressing hunger is the kind of work that, if done in partnership with a local bank, will meet the requirements for CRA credit. So there are a lot of opportunities here for your groups. And of course, the pandemic, as we know, has added a lot of urgency. You're going to hear about the central role played by SNAP, the Supplemental Nutrition Assistance Program, in their work. More than 40 million people receive SNAP benefits. But even after the legislation passed during the pandemic to address the sudden and intense levels of insecurity, the average monthly benefit per person is still only $150 per month. Now, we could call it the 45-55 recovery. In the last year, the stock market is up 45%. And many upper income Americans never lost their jobs because they were able to work remotely. On the other hand, visits to food banks are up 55%. And people who came into 2020 in a low wage position were far more likely to exit the workforce, at least at some point or temporarily, in the last year. 4 in 10 persons who used a food bank, did so for the first time last year. We have many newly hungry people now. And so I'm here to lay the groundwork for a conversation that I think you'll find to be very fascinating and illuminating. I've included some statistics, but the conversation that you're going to hear from our panelists will be fundamentally about strategy. They're asking where we should go next. In the last period of time, in the last 2 months, I've had a chance to work with them regularly, and they've taught me something which I think is really essential, which is that their goal isn't so much to provide more food, although of course that is what they do. They're serving meals in their states this morning, this afternoon, this evening. But they want to do more than that. And in fact, I think they would prefer to operate themselves out of business, because what they want to do is address the root causes of hunger. And they want to engage your organization in those efforts. So with that, I'm going to introduce our speakers. First, we have Matt Habash, who's the CEO of the Mid-Ohio Food Collective. He leads an organization that partners with grocers, food companies, farmers, the USDA, and many community-based organizations to distribute food to hundreds of locations across eastern and central Ohio. Beverly Wheeler is the director of DC Hunger Solutions. She's an adjunct faculty member at Carnegie Mellon's Heinz School of Public Policy, and she's a fellow at the Food Research Action Council. In DC, she leads efforts to improve public policy to end hunger, to reduce poverty, to promote nutrition and access to healthy and affordable food in low-income areas. Finally, Valerie Nicholson Watson is the CEO and the president of Harvesters, a regional Feeding America food bank that provides food and household products for 760 nonprofit food pantries, homeless shelters, children's homes, and community kitchens in 26 counties in Missouri and in Kansas. And with that, I want to kick it off to Matt.
Thanks, Adam. One of the challenges when you do a presentation like this is, we want to get into a conversation together and to share information together, but we have about 10 minutes to do a presentation, and I got about probably 37 years of history to combine into that. That's 10 minutes. But this for us has really been a shift over the last several years. I've had the privilege of being the CEO here for 37 years, and I've watched an organization grow, or as I say, failed miserably at my life's goal, which was to go out of business, as we've gone from a food bank that distributed 3 million pounds of food when I started in 84 in a year to over 85 million pounds of food, going the wrong direction fast in this country about food banks. So food banks really begin to step into work differently. And I think a number of us are really looking at how we feed people today, but also about what that looks like to really address the root causes. Our mission statement says, end hunger, one nourishing meal at a time, while co-creating a community where everyone thrives. Frankly, I think the Oregon Food Bank says it better. It's end hunger and its root causes. So we see that as a yes and strategy. I think for many, many, many years, it was either you were in the direct service side of the work or you were in the social policy change side of the work. And we've come to realize that, ending hunger means both. And we're stepping in to use the clout of the food bank in your community to really say, folks, we can't just keep getting bigger and bigger and bigger as food banks. We've got to step into this work differently. Unfortunately, this past year made that really hard. This is probably the most challenging year I've ever had in terms of, and just to give you a sense of the scale, we went from serving about 525,000 individuals a year to 660,000 individuals a year. We had 67,000 families in the last 13 months that have asked for help for the first time ever. We have a data tracking system. We've been tracking clients' data for 10 years. It's the first time they've ever had to ask for help. That had to be really, really hard. It was over 200,000 families got help last year from us, and 1.36 million visits to one of our 680 fabulous partners to get food. That is not the way we're going to end hunger. And, that was what we had to do for a pandemic. But we really believe we can do both. When we think about what this really means, I'm really excited about the fact that, when we talk about ending hunger and its root causes, when we talk about taking a customer-centric approach, that's our core value. It used to be client-centric. We now use the term customer. We want you coming back because 65% of the food I give out is fresh food. I need you coming more often. I know from diabetes research that we did back in 2012 to 15 with Bristol Myers Squibb, that if we could get you coming twice a month, we could lower your A1Cs and diabetes. We could work on hypertension. We could work on weight loss types of issues, healthcare issues, by making people who don't have regular access because they're food insecure to good, fresh food. When they could get it, we could see those kind of health improvements. It's the number one reason in our community why somebody asked for help. So we really have built a food as health strategy. That was the first step into the space, was to really say, how do we transform? And to recognize that if we can take surplus fresh food and make that readily available, we can make a huge difference. Second, when we look at how we can do things differently, we stepped into SNAP in a big way and really begin to say, we can connect people to a lot more meals by making sure that if they're eligible for SNAP, we get them signed up for SNAP. So we fought really hard, but we've also taken a different task with SNAP. We're now pitching SNAP, and we pitched it to our Senator, Sherrod Brown, several years ago to say, look at SNAP, not as an entitlement program we love to hate in this country, but as a good public health policy. It takes on a whole different meaning when you step into that space. So, and couple that with the fact that 7 years ago, we went to $15 an hour in an organization, then spent a couple years teaching other nonprofits how to do that, that they could afford to do that, and what that really meant, and then challenging corporations in our community. And I'm happy to say that Nationwide Insurance and Huntington Bank and Chase, which is a big employer in our community, those kind of corporate leaders and institutional leaders like Ohio State all followed suit, and you started to see wages come up. As I say, if you want to move somebody out of poverty, the only thing that matters at the end of the day is that their income went up / their household size. So we really have got to, as we have all these other building blocks, we've really got to come together. We've also realized that, how do we use food as an asset differently? And that's a big shift in our thinking versus we just are the wholesaler supplying 680 retail outlets and they worry about the hungry person, to saying, no, we're going to pay attention to all of that. And we're going to really look at what does a customer need? When do they need it? We call it right place, right time, right food strategy. Think of those as 3 circles in a Venn diagram, that sweet spot in the middle. And then what wraparound services can we say that are needed in each community and partner with others so that we can have really good case management. We can have workforce development opportunities. We can address healthcare. We can address, education, early childhood education, all the way up to post high school, and starting to partner together with partners to say, we're going to move people out of poverty if we collectively come together, look at the whole person. And that's really what has to matter. So a couple years ago, we changed our name from Mid-Ohio Food Bank to Mid-Ohio Food Collective. And it really was around the concept that recognizing we had other assets. Food bank's the one we're best known for. It's the biggest thing of what we do. But we also have, out of that diabetes research came Mid-Ohio Pharmacy, spelled Pharmacy, really about getting doctors in low-income clinics to write food scripts, to get produce. And then as they came to get it, we could track that visit data back to the healthcare provider, and we were seeing improvements in A1Cs, particularly in diabetes. So for us, it became, we can make surplus food in this country a healthcare strategy and live into that space, strengthening our partnerships with Primary One Health Facilities, which is a federally qualified health center, with managed care organizations that were managing diabetes, even with Medicaid talking about diabetes. Again, go back and look at SNAP as a really strong way to connect those, in a way for people to get regular access to food. We also could reduce their stress. We learned that from the research that we did because people knew where their next meal was coming from, and we could make that go away. So we're taking a holistic approach. One of our other assets is called Mid-Ohio Markets. We're beginning to shift the language of food pantries, which is a very, very stigmatized way of looking at how somebody gets help. It is hard to walk into a food pantry. You can imagine what those 67,000 families had to do in the past year. That is hard. And what we're saying to you, no, we want to have a very welcoming grocery store experience, a lot of fresh food, come back more often, take what you can use that week, know you can come back. And the facilities open 30, 40 hours a week, not 2 hours here, 3 hours there, the way some of our pantries have to operate. So we're really shifting that with the idea, and we're going to destigmatize them because we're calling them markets, not food pantries, and they'll look like grocery stores. We have 2 of them open. They've been wildly successful. One's on Columbus State's campus here in Columbus, which is a population of about 40,000 students going to school there. One of them in our suburbs. We went from 450 families a month when it was called a pantry to 1,200 a week. Really seeing an increase in the number of people coming, and then we can wrap around the services that are needed that they may need, whether it's workforce development or connecting them to healthcare. In this case, getting the COVID shot and all the connections around that. Mid-Ohio Kitchen's another asset, and it really was around taking a look at fresh food and how could we prepare some of that food. None of us go home every night, every day, and chop up vegetables and make a meal from scratch. Now, why do you think a person that is below 200% of poverty, that's our numbers, are going to do that? So let's prepare some of that food the same way we shop the perimeter of a grocery store. Take some of this food, cook it, get it ready so that students that are going to Columbus State and trying to raise a family can grab that ready-to-eat meal, take it home, have a good, healthy meal. So how do we make, in essence, the convenient choice a healthy one? So we're stepping into that space as well. And we have a Mid-Ohio Farm. It's really around high-tech urban farming. So think drones, think all kinds of computerization, vertical towers growing inside of containers, teaching people how to grow in their backyard, how to grow in a tower on asphalt, really connecting kids to food so they know where it comes from. And it really is around how do we build those things together. And to me, that's what this is all about. So it's a whole different way for us to really step into this space. in a collective way and to really look at the root causes. So we spend a lot of time talking to our partners. How do we stabilize families? What does that take? To me, you have to have a place to live first. When it's all said and done, that's primary. But if I had told everyone that's listening to this that you had to spend 70% of your budget on your mortgage or rent, your budget would change drastically. But that's the reality for many of the people that we're helping. So we've really got to work. It starts fundamentally with wages for us. It looks at the housing issue. It really looks at that. What are the healthcare options that you have, and making sure that you get access to it. You get fundamental access to good food. And we think SNAP has been a partnership that we couldn't do without. At the end of the day, SNAP EBT, which basically means emergency, that was what happened this past year, keeping those benefits going. That's what this is all about. Those are the fundamental issues that I believe we should collectively work on. So I'm excited about this. Adam said it well in the conversations we were having. My dream is to go out of business as a food bank. But yet we could still bring in fresh food and make it readily available. And you look at it as a healthcare solution. Farmer makes a little more money, and at the same time, we are able to get that fresh food where it's needed. So there's options for this to think differently, think holistically, think very person-centric, whole person. And that's really what we're all about. So that's my 10 minutes on where we are today. We're excited about the opportunity. Looking forward to the rest of the conversation. Thank you all. Back to you, Adam.
Thanks, Matt. That was great. I was thinking about wrapping up all the things you said, and you basically said them all at the end again, which is that you've really got a data-driven approach. You're using research. I love how you're thinking about a consumer-centric model. Your food pantries aren't food pantries. They're just like grocery stores. They're open, all those things that consumers deserve. And the linkage to health. And I would tell people that if you go on your website, you will see that there is a pharmacy, F-A-R-M-A-C-Y, a pharmacy. So I think you've made great points. And now I want to switch over to Beverly. Thanks, Matt.
Hi, thank you, Adam. Thank you, Matt, and welcome. As Adam told you, my name is Beverly Wheeler, and I'm the director of DC Hunger Solutions. We are an advocacy and policy group initiative of the Food Action and Research Center. So while we don't actually touch food, we make sure that our partners can. Our tagline is actually ending hunger in the nation's capital. People do not understand how much serious poverty and hunger exist in the nation's capital. And we do it in 3 different ways. The first way we do it is to look at federal nutrition programs. We make sure that the city is doing its highest and best use of all the federal nutrition programs. SNAP is the one we're talking about today, but we don't want to forget the Women, Infants, and Children program, or all the child nutrition programs, which include breakfast, lunch, after school, summer meals. We have a lot of senior programs. In the District of Columbia, we are #1 in senior hunger. That is ridiculous. There is no excuse for that. The pandemic pointed out things that we already knew, which were we had a large population of individuals who were food insecure, who worked in essential positions, who worked in the restaurant industry, and they were going to lose their jobs because they also didn't have a lot of health care, and they became hungry. Our food insecurity rate last year was 10.6%, which was too high, but it is now 21%. That's even worse. We've got to figure out how we can, in fact, help our individuals. So let me talk. I talk about the highest and best use of all the federal nutrition programs. And we do that by taking a close look at the laws, regulations, policies that affect the District of Columbia inside and what we can change. And we've had an opportunity to take a look. When they are good, then we help support them and make them better. When they're bad around hunger issues, we try to get rid of them. And when the government is silent, we will write legislation. And we are fortunate enough to have a lot of partners that help us. As I said, we don't actually touch food. My job is to end your hunger, not to keep you from being immediately hungry. So if you're immediately hungry, I will actually ask you and help you get in contact with one of our partners at the food bank, as Matt mentioned. So we have the Capital Area Food Bank. If you need medically tailored food, then we're going to make sure we get you in contact with our friends at Food and Friends who do medically tailored. If you're homeless or you need a program that helps you get out of poverty using food and a job, then we're going to send you to DC Central Kitchen. If you are a family and you need some help, we're going to send you to Martha's Table or any of the other organizations that actually do that. But we want to make sure that the city is using all the federal nutrition programs so that they can have dollars, local dollars, in order to assist other people in other programs. We know that when you're not worried about where you're getting your next meal or where your child is getting their next meal, that you can then use your resources to find housing, to get a job, to improve your education, to relieve your stress levels. We want to do all of those things that lifts you out of poverty, and then we can know that everyone is going to be healthy. So we've done a couple of pieces of legislation that we found very interesting. We did the Healthy Schools Act, which ensured that all children get breakfast. That's a critical piece for everything. It was so incredibly wonderful that we did the Healthy Tots Act. We want to make sure that the babies also get food. One of the things you'll notice about, you may or may not know about SNAP, is that it is insufficient. It usually is used up by the third week of the month. And the federal minimum for SNAP is $15. So we found when we went out and talked to many people, particularly our seniors, it wasn't worth it to them to try to get on SNAP for $15. So we proposed and helped pass legislation we call the SNAP Expansion Act. In the District of Columbia, the minimum you will get for SNAP is $30 because we found out that particularly for our seniors, that made the difference between food and medicine. And that extra $15 is made up in local dollars. That's how dedicated we are to this. And we're also very grateful that during the pandemic, that the federal government raised the SNAP allocations and that they're in place until 2021. We believe that needs to be longer. And we also believe that the foundations for SNAP need to change. A lot of people don't realize that SNAP is based on what we call the thrifty food plan. That's how they decide what should be in a SNAP package and what that ought to look like. What people don't understand is that the thrifty food plan was developed in the 1930s during the Depression to keep people from starving to death. It's a very different world now, and that it is still not enough. We would love to see the government go to the low food plan. That would at least give people about another $30 a month and allow them to get more fresh fruits and vegetables. So speaking of fresh fruits and vegetables, one of the things we do at DC Hunger Solutions is really to take a close look at healthy food access. We believe that having access to healthy, affordable food is a basic human right, and it ought to happen. We agree with Matt where healthy food and access to fruits and vegetables really is medicine. We know that in the areas of Washington, D.C. that do not have grocery stores or have minimal grocery stores, that in fact, there are a lot of diet-related illnesses that are actually shortening people's lifespans. And COVID pointed this out more than anything else. It was really devastating for us. So we take a look at some of those things. We also do direct service, and SNAP is one of our direct services. And we work very hard to get people on SNAP. We work with the Department of Human Services in outreach. We also, as part of our outreach, we train other organizations, service organizations, on how to get people on SNAP. We try to make sure that we're also talking to individuals about WIC. So we want to make sure that everyone gets a part of this, and that we look at policy and that we work together with everyone, because we know hunger is a solvable issue. We just need to make sure that we're working together to have it done. Thank you for the opportunity to talk to you.
Thanks, Beverly. And I actually want to emphasize something that she only mentioned slightly, but it's so significant. She talked about how people tend to run out of their food, their SNAP benefits, but before the end of the month. In fact, 90% of SNAP recipients are out of food by the last week of the month. And caloric intake goes down 15%, and hospital admissions go up, right? So the lack of enough food, which is rooted in the Thrifty Food Plan's allotment, is something that's a fundamentally important policy priority. So just wanted to capture that from what Beverly said. It's very important. And now over to Valerie.
Thank you, Adam. As Adam shared, I'm Valerie Nicholson Watson, President and CEO of Harvesters, the Community Food Network. We are a Feeding America food bank. We serve 16 counties in Northeast Kansas and 10 counties in Northeast Missouri. And as we, as part of this world, continue to live through a pandemic that has just absolutely wreaked havoc on individual lives and our global economy, we don't know when the pandemic will end or what the world will look like when we emerge from this global public health crisis. We do know, however, that its impact will be felt for years. And as we've already seen, its impact will be felt most deeply by those with the fewest resources. So before the pandemic, our nation experienced years of declining food insecurity. However, more than 35 million people remained food insecure. So that says we have a continuing problem with food insecurity. With the onset of the economic crisis brought on by the pandemic, food insecurity in 2020 increased to 45 million people, with that increase fueled by people who lost jobs and wages. And we saw that many people did not have a reserve that would allow them to sustain themselves financially during the loss of wages. You know, last August, the Washington Post reported that through recessions almost always hit lower wage workers the hardest. The pandemic is causing especially large gaps between rich and poor and between Black, white, and other minority households. Some economists have started to call this a K-shaped recovery because the diverging prospects for the rich and the poor. Clearly, we saw this after the 2008 recession. So when we talk about those who needed help before the pandemic, we see that during the pandemic, they needed additional help. But our member agencies reported that they were seeing a 30 to 40% increase in the number of people who were coming to the pantries. And primarily that was fueled by people who had never needed food aid before. And so really not only the depth of the need for food assistance increased, but the breadth of the need for food assistance increased. And that sends a loud message that we need to be doing something different. Clearly, if you are hungry, you need food assistance. But the bigger picture is, what is the impact of food insecurity? And again, what are the root causes of food insecurity? I know earlier in the conversation, Matt mentioned the Oregon Food Bank. and its mission. And I think that there are many food banks across the Feeding America network that are doing some really innovative things to address the root causes of hunger. Here at Harvesters, our mission is to feed hungry people today and work to end hunger tomorrow. And one of the things that we are in the process of doing right now is really defining, what does working to end hunger tomorrow mean for a food bank? You know, we made a commitment a few years ago that what we distributed in terms of food is just as important as how much we distribute. And that was really our foray into food as health, understanding that we needed to provide the healthiest food available to the people that we serve, because we know that nutrition is so important to maintaining a healthy diet and also in the maintenance of many chronic illnesses. So that was our first foray into going beyond just providing food. And I don't want to belittle that, because if you are someone who is food insecure, being able to access this nationwide network is so important to you and your family. But as most things mature, you have a greater understanding of the problem that you are working to address, and you begin to pivot into some solutions that are far-reaching. So for us, our first attempt was to begin to work with our medical providers. And you know, it struck me so much when the pandemic first hit and tests were difficult to receive. One of the first messages that was put out was, if you need a test, you need to contact your primary caregiver. How many Americans don't have a primary caregiver? That could be the difference between life and death, because we know that when you have a primary caregiver, you are getting more preventative care, and you are more likely to be seen by a specialist if that's what you need to do. So we started at a very simple and basic level. We said that we and the medical providers in our service area really see a lot of the same people. But for us, it's the food insecure who often cannot maintain or manage their chronic health issues when, as has been shared, food stamp resources might run out before the month is over. Years ago, there was a Feeding America study that shared what people do when their food resources run out. They may eat expired food. They may forego meals. We know this is not good. And so what we began doing is working with our medical providers so that they could ensure that the people they were serving, if they were food insecure, were able to secure resources that would provide a healthy diet for them. So we've done all kinds of things depending on who the provider is. One of the things I guess I'm most proud of is another diabetes study in which we are providing food boxes of nutritious, low salt, low fat foods for the people who visit that particular clinic. And so what we're doing really reaches a lot of people across our service area. I think that's very important. But we are also struggling, to be honest, with defining what ending hunger tomorrow means for us as an organization. The things that we do know is that as food banks, and particularly us as a food bank, we work with over 760 different agencies. And while those agencies provide food assistance, so many do so many other things that do address the root causes of poverty. And so as a convener, it makes sense for us to convene the members of our network to know exactly what they are providing and to work so that we are collaborating more. So that's one of the strategies that we're working on. You know, when I think back over the last year, I look back at 2019, and Harvesters distributed 54 million pounds of food in that fiscal year. By 2020, it was up to 64.9 million pounds. And then this year, which ends June 30 for us, we'll have distributed over 78 million pounds of food this year, almost 14 million pounds more than we did the last year. And the one thing that we know during this pandemic is that the federal nutrition programs were a key factor in helping us meet the increased need. And so Harvesters for years has worked to strengthen public policy and government funding related to hunger issues by engaging Harvesters, its member network, people facing food insecurity, and supporters in the legislative process on hunger issues. We've also worked to educate legislators about the impact of their decisions on food insecure people and the nonprofits they serve. So when we think about the things that were put in place in response to the coronavirus pandemic, we have to look at the Coronavirus Food Assistance Program, which we call CFAP, but it was also known as the Farmers to Families program. And it was created in direct response to increased need for hunger relief, as well as the disruptions to the food industry that resulted from the pandemic and the economic downturn. So this program provided pre-packaged boxes of fresh fruits and vegetables, dairy, and meat. And it also provided harvesters with approximately 1 million additional pounds each month. And that, if you see, really made up the bulk of our distribution increase. We could not have done it without the help of the federal government. And while food insecure people benefited, it was also beneficial to farmers who lost business due to restaurants, schools, and other food services that were closed due to COVID. And it also provided an economic impact for those people, for those farmers, because they were reimbursed. We've talked a little bit about SNAP, and it is really a highly effective program designed to meet the needs of hungry families, of farmers, and grocers. And I think it's a win-win model, really. We know it as SNAP, or the Supplemental Nutrition Assistance Program. And you know, once upon a time when you used to get coupons, now you get the EBT card. And so it makes it a lot more convenient. But what we know, pandemic aside, you know, research shows that SNAP plays a critical role, not just in alleviating poverty and food insecurity, but also in improving the dietary intake and the health, especially among children. So it dovetails with Harvesters' mission of a future in which we all have access to enough nutritious food to live healthy, productive lives. But unlike those CFAP boxes or a trip to the local pantry or a mobile food distribution, SNAP allows participants to select foods from their local grocery. And that enables them a wide variety of choices to meet their family's religious, cultural, or preferred food needs. So Harvesters does SNAP outreach to assist individuals and families in determining if they meet the requirements for SNAP participation. And so we just started a collaboration in Kansas. We serve counties in both Missouri and Kansas. There are 3 Feeding America food banks serving Kansas, and we are in a collaboration to do statewide SNAP assistance. And it is basically, it's really I think an important resource for the participants in Kansas and really participants across the country. So for us, what we do is help people determine if they meet the requirements for SNAP participation. And if they do, we can also assist in the completion and the filling out and the filing, of the SNAP application. It's an important resource, but it's not a perfect resource. There are some barriers to the program, and we may touch upon them a little later as we speak. But I think at the end of the day, we know that the need for emergency food assistance, and I say emergency probably differently than the food bank founders of 40 years ago did, because what we found is this food is sustaining for people who just don't have the resources to meet their monthly cost. And it's so important in this country that we be able to provide a living wage, really, that will enable people to be able to live a modest, stable lifestyle. Back to you, Adam.
That is great, Valerie. I really, so many points there. And one thing I want to mention is that we've had a lot of comments about health, and this is exactly what your organization is doing in so many different ways. It's almost as if there's such an integration. It's no longer just meals, it's the whole person. I want to briefly kind of contextualize some of this in the context of what I think many of our coalition members are doing. I think it might be possible for folks to say, hunger, very important. But I'm a leader in building affordable housing, and that's an important thing. I'm concerned about hunger in my community, but I have a lot to do and only so many funding resources with which to do it. And similar statements could, not just for people who build affordable housing, but the same thing could be said elsewhere in terms of serving justice-involved populations, working on the rights of families, working on behalf of our newest Americans, anyone who's marginalized in any way. These are all important endeavors whose solutions are urgent and also ones that are very important, right? So, but here's the context that I think is important: is that we're all serving similar populations, right? And you've heard panelists today talk about how hunger is an expansive problem. It's not just something that exists in a silo, but it's something also that community-based organizations of all types can join. Hunger is a housing problem. Hunger's a jobs problem. Hunger's an education problem. It's a justice problem. And to the extent that hunger leads downstream to those problems, it's the same function the other way. It's a two-way street. A lack of housing becomes a hunger problem. A lack of a job creates a hunger problem. A lack of education prolongs a hunger problem. And one thing that I wanted to mention, which I think is another additive point here, is that SNAP, while most often associated with providing stipends for the purchase of food, also has a program, a very significant program, that addresses workforce opportunities. And again, the lack of a job is a fundamental problem, or the lack of a job that pays a living wage. 40% of long-term SNAP recipients have a high school degree. 50% have less than a high school degree. There's a vital need for more training opportunities. So there's a program called the SNAP Employment and Training Program, SNAP ENT, that provides funding, federal funding from states, or federal funding for states, to build workforce training programs. And this is something that's truly a across the aisles political winner. And yet at the same time, SNAP ENT, well, according to a recent report from USDA, they put it simply, SNAP ENT has been historically underutilized. And the missing piece, and again, really key for our coalition here, is that the missing piece is often finding a state partner and local community-based organizations, and in particular community-based organizations that can understand and work inside community values, right? So I encourage all of you to reach out to NCRC. We have staff members who are working on the SNAP ENT program. We are a partner organization in the largest community-based workforce development program in Delaware. We're building out a pre-apprenticeship program in partnership with minority-led trade unions in Philadelphia. And all these efforts are based on building opportunities for people to have living wages. Because just like we're trying to end hunger, we're trying to end hunger through finding sustainable ways to support people so that they can then move on and be free of hunger, but be secure in many different ways. So the bottom line is, if you're in a community and you're trying to solve one of the outcomes of hunger, then you already know through the faces of the people that you serve every day that economic security doesn't exist all by itself. It's an overlapping issue with overlapping layers of inequity. Since I'm speaking, and this is about the last part I'll say, with a coalition of organizations that have a deep understanding of local and state politics, but I want to reinforce something that you probably already understand in your current context, which is that we cannot think of our collective work in zero-sum terms, right? If the organizing that we do to generate the political will to resolve hunger in our communities is something that the city council funds, but at the expense of affordable housing, or let's say after-school programs for teens, then we really haven't had a win, right? When your organization builds housing, when you are working to prepare people for jobs, when you're working to support small business development, inevitably you're also working to address the root causes of hunger. So having said that, because I really felt like it was important to add on this workforce part, I wanted to then kick it over to our panelists and engage in kind of a more open-ended conversation, and addressing some of the comments we've seen. Maybe kick it off with, I'm curious if people want to talk more about how health is something that is emerging as a fundamental part of their strategy.
I can glad it definitely, and I'll just be brief, it definitely is at the top of our list. I think one of the things that, if I could leave you with one message even above that, and I use this a lot, Ohio State had a food insecurity summit a few years ago, and I got to close it, but I also said I wanted to open it because I wanted them to think about the fact that food insecurity has nothing to do with food. At the end of the day, it's a resource question. And the people that we're all helping, when you look at the collective, from all the things that Adam talked about, at the end of the day, it's about choices people have to make, and they're not good enough economic choices. They don't have the resources to go to the grocery store. Believe me, that's where they would rather go get their food. And they're choosing between housing and rent, and food. They're choosing between utility bills and food. They're choosing between healthcare and food. And I think that's, if we learn anything through all of this, is we're not competing with each other across those different strategies that our people need to, work on. We're all in this together, and we've got to come at it in a collective way. For us, it's been around, we got access to fresh food that's in the fields. We can help pay the farmers, we can get that food in, and we can have health outcomes. That's what matters. To me, my new measurement of success that I have not figured out is, what's the health impact of us getting you food on a regular basis, particularly fresh, healthy food.
I'll jump in. There's that old saying, if you don't have your health, you don't have anything. And you can think about it in those terms. And when you think about how important nutrition is to health, you also have to think about the financial or economic impact that poor health results in, whether it is lost productivity and lost wages for a household, or lost productivity for a company. And so one of the reasons that we started with nutrition and healthcare was, we believe that when we look at the people we serve, and some of those barriers to their ability to be able to create a sustainable, modest lifestyle, we found that so many had chronic illnesses. At least one person in the family had a chronic illness. And if we could partner with the healthcare industry to help those people better maintain their health, then that's what we wanted to do. And it kind of goes back to, preventative medicine, maintaining your good health, or emergency room visits. And it just makes sense that people be able to have enough nutritious food to maintain their good health. Because once you have your health, you're able to move on to other things.
We've been really fortunate, and thank you, both Matt and Valerie. We actually train up and coming physicians about food insecurity in the city and what they can do. We have gone on grand rounds at some of the hospitals to let them know what that in their communities, this is what hunger looks like. And we actually have a referral process for many of our, for some of our hospitals, where when a doctor identifies an individual as food insecure, they can refer them to us, and we will work on getting them into SNAP or any of the other programs. Technology is really helping us do this. So if any of your constituents are looking at that, we're now looking at databases that are maintained in the hospital and the community-based organizations that do outreach. And once a person is identified as food insecure, they're actually referred to us to help them. And they're also tracked so we can find out, did they get food? Did they get on a program, so that we can make sure that that's there's a follow through on that, and we're not just sort of handing them off a piece of paper. So we really are looking to work with a lot of organizations around health, particularly physicians. And we have Produce RX, where actually doctors can write a prescription for healthy for fruits and vegetables for individuals to take in the grocery stores. And we recognize health is critical, and food insecurity is really something we have to deal with in order for people to have their health.
I wonder if folks would have things to say about what they think their communities will be seeing post-pandemic.
The only thing I guess, offer to that is we're in this for the long haul. This is not going to be an easy one just because people are getting vaccinated, or at least the majority of the country seems to be headed in that direction. This is going to take a long time. I think what we all know, Valerie and I have been around a long time in the world of feeding people, been through recessions in the past, and it takes 5-10 years to come out of those recessions. And I think this one's harder because a lot of people made a lot of money. The K analysis of, some people have done really well and other people haven't is real. And it's going to be slow coming out of this, and people are going to be asking for help for a long time. And I think that's, hope donor fatigue doesn't set in. People don't start. What happens is people blame the victim. It's your fault. Now all of a sudden, because there's jobs available, but the jobs that are available right now are high risk jobs with low pay. Why we wouldn't do it? Why would we expect somebody else to then put themselves at risk? And I think there's a lot to be. I tell people to be patient. I think one of the other issues that ties this together is the issue of mental health. That is something that we're going to have to come to grips with. This pandemic has really brought that to light, and there's a lot of challenges for everybody in the mental health space, and we don't deal with that well in America.
I agree. And we have experienced this in the past, where we go through a recession and then we begin getting news that, the economy is recovering. The stock market is doing great, but that leaves such a large portion of our population behind. And so as we begin to hear news that our economy is improving, we need to understand that it's not improving for all of us, because even before the pandemic, we had 35,000 food insecure people. And so as we move forward, we know that the need for food assistance will remain high. And we will continue to provide that food assistance while we also continue to work on strategies and form partnerships to help address the root causes.
I would love to see the members of NCRC work around SNAP education and training. We found that if we worked with the restaurant industry, that we could actually train individuals to work in their neighborhoods, either in the restaurants or working on preparing food for the hospitals, anywhere where we could also bring in federal dollars, but we need partners who will do the training. And we talked about this just a little bit earlier, but I think SNAP education and training programs, we get an opportunity to take advantage of those. We get people back into the workforce, we get economic development going on, and it helps everyone. So I would say if there's one thing, help work around SNAP education and training.
I wonder, just taking that a little bit further, SNAP is a program that's funded federally, but then a lot of the decisions are made at the state level. As you think about what people can do politically, what are your thoughts on points that might be important to raise, and maybe where and with whom? I imagine this is a question, Beverly, just knowing a little bit, she might have the first comment to say, but I think this is important to our members.
No, I think you need to first educate your local legislators about what SNAP is and what it isn't. How much, I'm always telling them how much money they are leaving on the table when they don't incorporate SNAP and SNAP education, SNAP training, SNAP, any of the federal nutrition programs. So educate yourself about what they are, and then tell your legislators, once they realize how much money is left on the table, they will make big efforts to go and improve that.
And I think we also need to make sure that the program is doing what it is intended to do. One of the things that we've been fighting here in Kansas and Missouri is one of the requirements on an application that says you will cooperate with child support enforcement. And our staff has found that 25 to 30% of applicants in this situation decline to go further with the application process out of fear. And this has proven to be a significant barrier for some of the people, mostly women, who have concerns regarding their personal safety and the safety of their children in relation to this requirement. So we've got a good program, you know, a basically good program, but we just have to make sure it is working for the purpose it is intended to.
The only thing I would add to that, I think is, in a lot of ways, this is like voter fraud. You got people saying there's voter fraud, rewriting the rules. There's not that much, it's tiny fraud in the SNAP program. And most of the time we find it's not with the recipients, it's with the merchants in certain circumstances. So we've got to get over this. We've really given SNAP a bad name. And if I could do one pie in the sky, real big change, I would get rid of the benefit cliff of SNAP. If you truly can align business together with human services and do what we do in childcare, where it goes up to 300% of poverty, in a sliding scale model, then you don't have people. There's a lot of people struggling that are just above those benefit levels, and they get kicked out. So there's a lot in all of this. There's a lot of requirements being put on a program that doesn't need them. ID requirements. As stores go to automation, we're now saying validate IDs. I'm like, it doesn't work in a grocery store. It's that kind of thing that says, look, this is about helping people, letting students get this that are going to college. That's a big deal. Why would we not want to help somebody that's trying to get their next degree? For our team around here likes to say, their second job that's a much higher paying job. We've got to rethink our benefit structure. We penalize people instead of really saying these are building blocks. We ought to come up with strategies to allow people to access them so that they can, in fact, improve their own lives.
Well, I'm thinking that, we've covered a lot. I would like to ask one more question that I see in the panel, in the comments from our audience. And I don't know, there's a question about school meals and whether or not that support for that will be extended, because there has been some support for it in legislation, PEBT, things like that. What's your take on the chances of that being extended and made permanent?
Absolutely. There's no doubt about it. We're already working on Capitol Hill. That's the child nutrition Act is they're already working on it. And with PEBT being such an incredible, wonderful savior for a lot of families when the schools closed, and the expansion of PEBT to the end of September, I think you're not going to, it's a wonderful, we realized during the pandemic, it was a wonderful way to help families keep fed.
I would agree with that. I would just encourage us to really look at SNAP for the summer, and extending benefits to SNAP. I mean, summer feeding is a wonderful program, but it's still an administrative, got a lot of costs in it. Giving people more dollars on their SNAP helps people that are eligible. So I think and schools are essential. I have 101 school districts in my 20 county area. When they shut down, there was a huge increase in need for help. Universal meals, getting rid of the stigma of free and reduced price. Those things make sense. Why not feed kids breakfast and lunch at school and quit worrying about whether they're income eligible or not, and all the stigma that goes with that, as you're a high school kid or a middle schooler and you get stigmatized. Let's eliminate that and just feed people. And it was designed to be a healthy food program when it first started. We got to get back to that kind of thinking.
Absolutely.
And I'm just going to agree with everything that has been said. It is so important that, we talk a lot in this country about self-reliance, but what we really need to share is that we all sometimes need some assistance due to no fault of our own, and clearly children cannot be faulted for anything that they have, don't have, or that they need. And I think it just makes sense for us as a country with all of the resources that we have to ensure that we have healthy, safe children who are not stigmatized or denied basics. And food is always a basic.
Well, this is great. I want to give folks the chance to say one more thing, if it hasn't been covered yet, that you just wanted to get across to our members before we go. So offer your thoughts.
So I'll start. One of the things I would love them to remember that SNAP also contributes to the community. That people who receive SNAP are not putting the money in their 401ks. They're actually spending it in the community. And studies show that SNAP expenses, once it's spent, generates about $1.50 to $1.80. So we're actually benefiting the communities in that. We need to remember that on some of the things that we're doing.
I would echo that. It is a win-win proposition. It helps the people who receive SNAP benefits. It helps the farmers, and it helps local economies because those SNAP dollars are being spent in our local groceries.
I would just add to that. And I mean, I had a lot of grocers that were hesitant about lobbying for SNAP, and it was 40% of their business in some of these rural small communities. I said, why would you not want to do that? So it's an education process. But I think overall, just for everybody that's in the audience, we're all in this together. And I think it's a recognition that, collectively, it's not about the silos. I think we've learned a lot. Human service organizations and healthcare and education, we're all working really hard in our lanes. But the reality of it is we need to take a very person-centric approach and say, how can we collectively live into what collaboration and collective impact really mean in your community? And I would just encourage that.
Well, this has been great. I want to thank all of our panelists. I think you've really brought a lot of interesting commentary to our audience, and I appreciate it. To our audience, I'd say, please, if you have comments or questions, feel free, certainly leave some feedback in the chat, but also if you want to reach out and engage further, please do so, because obviously hunger is not going away. We aren't out of business yet on this field. So any kind of interaction that you feel that would be useful in your community is something that is very important to hear. So with that, thank you. Have a good afternoon.